Alrighty, the recording is started.
Great. Thank you, Travis. I'll call this meeting of the Assembly's Committee on Housing and Homelessness to order. It's September 15th, 2021. We're noticed from 10:30 to 12:30, a little bit extra time today to make sure we can accommodate the full agenda. Ms. Turner, could you please call the roll?
Yes. Miss Allard? Mr. Constant?
He is excused.
Mr. Dunbar? Miss Kennedy? Miss LaFrance? Mr. Perez-Verdia?
Here.
Mr. Peterson?
Present.
Miss Quinn Davidson?
Here.
Mr. Rivera? Mr. Weddleton? And Ms. Altel?
Here. Thank you, Mr. Turner. Hopefully, we will have a few other members join us as we move through the meeting. It is a half hour earlier than usual and after a late night. So with that, we didn't have anyone sign up for initial audience participation today. Go ahead. Okay. Before we get started in the business, I just wanted to take a moment, thank everyone for joining us via Teams. Right now, I think this will be at least this month and likely next month how this committee will convene, given the current rate of COVID, unless we're able to institute some specific mitigation. But I understand that Chambers is not available for the October meeting. So please just be prepared to do this meeting probably this month and next month via Teams. We have, as always, a robust agenda. We're going to hear from Parks and Recs today. We're going to also talk about shelter outflow, a mass care update, and then we're going to hear from the community resource coordinators from the library. So with that, Mr. Durand, if you are on, I will turn it over to Parks and Recreation for a healthy spaces update. Oh, and members, please feel free to either text or put in the chat if you'd like in the queue. Thanks.
Okay. Thank you, Assemblyperson Zalatel. And my name is Josh Durand. I'm the Director of Parks and Recreation. And I'm here to give an update on Healthy Spaces. It's a division within our department that addresses camps, the abatement of camps within public spaces, and loose trash associated with the homeless populace. The division continues to focus on loose trash within our public spaces. This focus currently has been predominantly within the Midtown area, the Spenard Corridor, downtown, and areas and neighborhoods surrounding the Sullivan Arena. Last week, we recently removed a handful of singular camps that popped up in both the Chester Creek Corridor as well as the Campbell Creek Corridor. We are currently working within Davis Park. We have a large effort in front of us there, and we do have a singular camp that we'll be working on within Valley of the Moon Park in close proximity to the popular dog park. We did get some recent reports about some new camps coming up in Russian Jack Springs Park, specifically the south area. They are having fires and they are building a robust structure, and we will be addressing those more than likely within the next 2 weeks. Winter is approaching us. We can see that by looking up at the mountains to the east. And with that, our division will be transitioning into our winter operation mid-October. And that entails a large component of the Healthy Spaces division is seasonal positions. And so we will be transitioning from a seasonal group of about 14 to only 3. We do have 6 permanent positions associated with the divisions. They will continue to remain, so we continue that institutional knowledge. And we do have an opportunity this year. This year is a little unique with it being the first year of the division. Funding became available with the new budget year starting in January. However, the division did not start until April. And because of that, we are positioned to have a more robust seasonal workforce for this winter, and we aim to do just that. Let's see. One of the big challenges with the winter operation is snow, and this does impact access to areas. It does create some safety concerns, and some of the ways that we mitigate that is through the use of equipment. Some of our concerns as it relates to doing camp abatements during the winter months is oftentimes these camps have a fair amount of hypodermic needles, and we do need to use equipment to maintain safety. And we also have these greenbelt corridors that go through our park, and we do groom and maintain them. With us using equipment, we need to be sensitive to the recreational and transportation use associated with these corridors. And because of that, one of the pieces of equipment that is really paramount for the operation is the use of snow machines and sleds for accessing some of these areas and not impacting the groomed snow tread in these corridors. Other pieces of equipment that we have access to deal with safety concerns for the winter operation is we have skid steers, we have loaders, we have backhoes, and we also have a really neat new device. It's a mini loader that articulates, and it has a grapple, so we can grab things without using physical hands and keep the team safe. Shelter capacity will continue to be a paramount constraint as it relates to abatement, and that will be especially important as we transition into the winter months. And that's all I have for an update today, and I am available for questions.
Thank you, Mr. Durand. Before we turn to questions, I'll note for the record, we were joined by Mr. Weddleton and Mr. Dunbar at 10:34 and Ms. Allard at 10:36. I appreciate the update on winter abatement and the efforts being put forward by Parks and Rec. Particularly, I've heard some really great feedback about the ongoing trash cleanup. So the efforts are noted. Any questions for Mr. Durand? I am not seeing any in this moment. So thank you as always for the update, and we will, I'm sure, talk to you again next month.
Okay, thank you.
Thank you. All right, moving on in our agenda today, we now are going to turn it over to the Anchorage Coalition to talk about shelter outflow and the housing surge update.
Thank you, Assemblymember Zalatel. This is Jasmine Boyle. I am the Executive Director of the Anchorage Coalition to End Homelessness. I also have Taylor Donovan, our Director of Operations, on the line, and she'll be talking about the data this afternoon. So as we discussed last month, the coalition has begun working with partners around the community on a housing surge. Won't go back into detail about this again, but I provided it this month just as a reminder of what the scope of this work is. Very specifically, we're focusing on a housing surge for adults over the age of 25 who do not have dependent children in physical custody with them at this time. In the vernacular, we call this single adults. This is the vast majority of the individuals living in the Sullivan Arena, our mass care hotels, and Brother Francis, and almost always the individuals who are in our camps and other locations.
Ms. Boyle, I'm sorry to interrupt. I wanted to note we've been joined by Ms. Kennedy. And did you need us to share your slides, or did you want to share those?
I am happy to do that myself. Can you see them now?
Yes, thank you.
Perfect. Thanks for the reminder. So again, this is just a backdrop that there are two levels to this work. There is a governance group that is really about making sure that we are focusing efforts that have already been funded at any future efforts that are going through a funding or a policy change process, and that we're really building on the Lego pieces that we have available right now in the most coordinated and efficient way possible. And it really does help to have the individuals who have the authority of those organizations, of the funds, of the policy in that weekly meeting so that we can problem solve bottlenecks. Separately than that, as I mentioned last month, we have a group of folks that's meeting to actually talk about the clients in need and to be moving those clients into the services that are available. Again, our commitment to the administration, the Assembly, and the Anchorage Health Department is that we will present a brief update every month on this work. Again, on the slide in front of you are all of the different participants who are meeting with us weekly. This does not include the many other social service and organizations and nonprofits who do the work of homelessness, who are working with us through case conferencing and other efforts. I do want to talk about accomplishments in August. First and foremost, most importantly, by a mile, we saw the first participants of the housing surge housed in what we believe to be sustainable housing for the long term. I'll talk a little bit, actually, Taylor will talk a little bit more about that when she talks about the data. Of course, you're all aware that the RFP came out for mass care operations. Again, this is August reporting, so of course the vendor has been selected for that contract already, and I suspect all of you are aware of that. Another significant milestone that I mentioned as a challenge last month is simply that a number of people in our shelter system need a higher level of care. These are individuals that have been bused or flown in from other communities out of emergency rooms. These are individuals that have been evicted from assisted living homes. These are absolutely individuals that will not receive the care that they need in a traditional shelter or a mass care shelter. And so a big piece of that work is partnering with the state. And there was a request from the state of Alaska that we do a release of information for every individual living in any of these locations. The reason for that is we need to assess basic Medicaid eligibility and Medicaid connectivity before we can start helping folks get connected to these more behavioral health oriented, substance misuse oriented, or higher level programs. It was a massive effort with no additional resource requests. And so I do want to just take a moment to thank the staff at Mass Care, the Bean staff at Sullivan Arena, and absolutely the staff at Brother Francis. It's very hard to work with clients and ask them to fill out more paperwork without very clearly telling them what they're going to get to complete that more paperwork, because they've often completed paperwork like this dozens of times. It was a huge effort to do this in the time of the pandemic with competing priorities. That was all sent to the state of Alaska at the beginning of the month, actually the 1st. And now we're waiting on a response on how we're going to coordinate to help these individuals get access to this higher level of care. So effectively, things are moving in the right direction, though the pace is still building as it is a new initiative. Again, I shared this last month. These are projections that came from our partners at Mass Care, essentially saying that the intensive case management contract with Catholic Social Services was scoped at serving and housing about 25 individuals a month, that through medical and care coordination that I just mentioned, we should see at minimum 100 individuals that are moving into higher levels of care. And then of course we can go down the list, but that there were a number of ways that Mass Care was estimating that decompression of our temporary shelter services could be accelerated. Building on top of that, we did commit to providing you guys a monthly report of how things are going. And so I'd like to turn it over to Taylor just to talk about the data from August.
Thank you, Jasmine. Hi, everyone. This is Taylor Donovan, the Director of Operations from the Anchorage Coalition to End Homelessness. Part of our agreement with this was reporting on our monthly work through Mass Care and the housing surge, as well as an update on outreach. We'll start with the monthly update from Movement Out of Mass Care. Last month, we look first at the total number of individuals experiencing homelessness who are in need of housing. So this could be those who are staying in shelter or are unsheltered. In August, we saw 2,351 unique individuals either interact with street outreach or with shelter at some point during the month. That's down about 100 folks from July, and we generally see variance from month to month in that number. When we start to look at those who were served in the housing surge services, again, Jasmine highlighted some of those, but that could be rapid rehousing, new programs coming online, intensive case management. We had 172 individuals connected with in the month of August, up from 73 in July. And of those 172, we saw 19 move into housing at some point during August. That is up from July of 0 individuals moving into housing, and we generally anticipate that will continue to increase over the months as programs begin to sort of ramp up. Most programs started really in July or August, so 19 individuals moving in is a huge success for the community, and we anticipate to see that increase as more staff are trained and programs really start to ramp up their services. Average length of time from the start of their kind of interaction with services to their housing move-in for those that have moved into housing was 23 days. Of note, that's significantly lower than our general length of time in other services in the community. So seeing some really big successes in the housing surge and some of the work. We also have a lot of other programs that are starting up. We talked about connecting folks to assisted living facilities and have really started to move on achieving person-centered intakes and kind of the first steps to the Medicaid waiver for many folks. And if we can move on to the next slide, please. I will hand it back to Jasmine to kind of discuss some of the bottlenecks and challenges we saw.
Thank you. Again, it was requested that we report out to you all monthly where the challenges are. Some of this has not changed. I actually want to start with the last item. The biggest barrier that we are running into right now is a 2% vacancy rate for apartments in Anchorage and a 2.5% vacancy rate in the Valley. What that means is that we can do everything we can to help people be housing ready, to get them connected to higher levels of care, to get them connected to case management and resources, but that there are not enough apartments available for the number of people in our mass care facilities, and that our landlord partners, particularly our large scale landlord partners, are saying there isn't really a lot of incentive to rent to people that could be perceived as higher risk renters, or at least renters that have recently experienced some financial challenges with COVID. When there is such a limited apartment stock available, I think we all understand how the market works. And so one of the biggest barriers that we're going to run into is the issue of just having enough apartment stock, and in some cases, apartment stock that is affordable, that our clients are eligible for, specifically with a relation to rent to income ratios, and very often apartments that are ADA compliant. I think I've said this to the assembly previously, but Access Alaska estimates that prior to COVID, there was a 2 to 3 year wait list for affordable ADA compliant apartments in Anchorage. And that has nothing to do with homelessness. That's literally for individuals that do need apartments that are built around their ability level. So the housing surge is going to continue to run into this roadblock. I suspect all efforts around homelessness are going to run into this roadblock. But we have shared with the facilitation members and the process that this needs to be a piece of the thinking moving forward, because we will not get individuals out of shelter if there are not apartment units to move them into. And again, that spans the spectrum of people who are employed and sitting in the Sullivan because they simply are not employed enough to afford the apartments that are available, all the way to our more complex cases of individuals that are going to need more than just an apartment to move forward. Again, I suspect that folks are aware that AHFC has opened the second round of applications for rental assistance. So we are in a time where we now have the case management necessary to assist people. We now have funds available to help people stabilize for the short term in their apartments. We also have some job opportunities and employment solutions. But again, the roadblock is going to be we simply do not have apartments that are available to anyone, specifically in this case, our clients, And as I've shared with the Assembly a number of times, housing is the solution to homelessness. If we don't have the apartments, we don't have a path forward to help people end their experience of homelessness. That being said, there are a couple of other roadblocks that we are navigating. Again, I suspect that you're all aware that there have been changes on the federal stage with benefits, the additional unemployment, some of the additional food services, and very specifically the eviction moratorium have ended. Those economic changes will impact homelessness in Anchorage and the greater state of Alaska. That's not new news, but that is now a current event that we need to mitigate and continue to monitor. And I think then again, we run into those resource and capacity restraints with behavioral health and care coordination services on the healthcare side, that even as we're beginning to work with our state partners on helping these individuals that do have more complex cases navigate into the behavioral health system or the assisted living home system, they too are dealing with the impacts of COVID. Very specifically, that there are significant staff shortages on the side of assisted living homes, and that the wait list for many assisted living facilities can be upwards of 6 months. So I will continue to share with you that we are putting the building blocks in place that have been missing for decades. But we continue to run into hurdles, and that I believe is an important part of this conversation. Finally, I think there continues to be a lack of coordination and communication across all parties. We have made significant inroads with the provider community, our funding and philanthropic partners, but there still seems to be some confusion about announcements and communications, in part about what's happening locally. Again, my example for you all is to the public, the Sullivan Arena is expected to end today. And there hasn't been public communications that we will be extending the Sullivan Arena. I think many of us that are closely following this issue, many of us that are involved in the day-to-day of the facilitation process, we understand that there is likely to be an extension, but that hasn't been communicated to people experiencing homelessness, to the provider community, or to the public. So I will tell you that I'm getting a barrage of phone calls daily, and this is a communication issue. This is not a lack of strategy. So one of the things that we continue to work with on all parties is, how do we make sure that we're all working together to use these resources wisely, and that we're communicating about milestones. And as you all know, a core part of Anchored Home has always been transparency with the public. So just making sure that that communication is getting out there to the public as they have questions, and as we have collectively made commitments on the work around homelessness. That being said, I'm going to turn it back over to Taylor just to wrap us up and talk briefly about street outreach, which is the other item we committed to reporting on.
Hello again. Part of our work as ACH is coordinating various outreach entities that are funded either through the municipality or active in Anchorage, connecting to unsheltered individuals. In August, these outreach teams contacted 49 unduplicated clients, so 49 unique clients who were unsheltered. 6 of those were brand new to homelessness. They were experiencing homelessness for the first time in August. And as part of that, 37 of those individuals received what's called a coordinated entry assessment. That's part of our work to understand and then prioritize individuals for resources in the community. The other piece that Outreach has been working on for about the last year is connecting unsheltered individuals to both COVID vaccines and testing. In August, we had teams go out with Visit Healthcare regularly and offered 5 COVID tests in August. That brings us to a total of 575 COVID tests for unsheltered individuals since July of 2020. And then in August had 1 vaccine opportunity for unsheltered individuals, where 1 individual received a new COVID vaccine, and that brings us to a total of 95 vaccines offered to unsheltered individuals in partnership again with Visit Healthcare and our outreach teams since May of 2021.
Thank you. That is what we have for this afternoon. So I will turn it back over to Assemblymember Zaletel.
Thank you. I have a question here from Mr. Weddleton.
Oh gosh, I actually have a list here, but I don't want to dominate so much. But geez, that's the last slide. I mean, 1 vaccination. It seems very light, and then it basically was at 90 contacts from outreach. It's like how many people are doing outreach. I mean, just those seem kind of lean. But the important questions are, so we're doing the housing surge because this is very important to figure out. You know, how many people should we prepare for who won't be able to find housing between now and whenever, a year from now, 6 months from now, and realistic. I mean, in one of your slides, it suggested that the housing surge, you know, adding it up, had 665 people housed, but I'm thinking that's not it because we saw later that it was really, I think, 19, and that's good. But you know, what should we really expect between now and you know, the end of the year and maybe 6 months from now that would be housed and not in mass care or in the hotels or whatever?
Thank you, Assemblymember Weddleton, through the chair. These are the estimates that were provided to us by Mass Care. Simply that this is what the projections were by the folks that are closest to the front line through Mass Care Services for the next several months. And I believe that we have Mr. Dole on the phone, and he could probably speak about those. It's very hard to predict outflow until we get a couple of pieces moving. One really important piece of this is United Way was contracted with the city to do landlord liaison work. Part of that was to build a pool of landlords that would rent to our clients. That theoretically would accelerate this process and allow us to have some better numbers on how many people we anticipate flowing into mainstream housing. Again, there are a number of folks that are employed and have been employed for the entirety of their stay at Sullivan or other locations. They're just not employed enough, or they're not as attractive to the landlord community. And so these are puzzle pieces that are still moving. These are projects that are starting in real time around us. I don't have better numbers than this, Assemblymember Weddleton, at this time, but I expect that we are going to continue to refine our projections in the next couple of weeks. I'll also say, in regards to the vaccination question that you brought up, that there's two pieces to this. And one is Mass Care has been offering vaccinations to people experiencing homelessness, both at Sullivan, at non-congregate locations, at other locations. Last I heard, 80% of the clients at Brother Francis were vaccinated. So there has been a lot of vaccination momentum. What Taylor reported this afternoon was vaccination reporting at unsheltered locations, so the camps, in the last month, not the totality. One opportunity that we had with the state of Alaska that we did not pursue in Anchorage was putting our vaccination data in HMIS. Unfortunately, that was declined by the city early on. So I cannot report to you the total number of people who are experiencing homelessness that are vaccinated. We can do that for the rest of the state. We can't do that in Anchorage at this time. But I suspect that our healthcare partners could run that data. We do believe, though, that the majority of people in our shelter system are vaccinated.
And that's very helpful because seeing that number one was sort of depressing. So thanks for clarifying that. So I guess just until you pull the plug on me, Meg, because this screen that's up now is very encouraging. I mean, if we can honestly get that many people housed in 6 months or whatever it would be, that makes a dramatic difference in the amount of congregate beds we have to have. So is there? But this is sort of a hopeful list. Do you have like a give me the probability or a range of error or something? Is that possible, or are we just? Because when you compare that to the 19 that was reported, which is vastly smaller, I mean, what's our range of hopefulness here?
Yeah, I'm going to turn it over to Mr. Dole because these projections came from Mass Care. But I will say, Assemblymember Weddleton, it is not a static number. And what I'm always careful to say is inflow continues to be significantly higher than outflow. And so part of the challenge is, as the eviction moratorium ends, as these other benefits reduce, even the conversation about the PFD, as these challenges unfold, every single day we're hearing about new people experiencing homelessness. And so part of the problem is we can talk to you about outflow, but that needs to be reflected in the conversation of inflow as well. So we continue to stack up more people in need. The outflow has never, to our knowledge, successfully matched or exceeded the inflow. And that makes the fact that we will continuously need more shelter until we can deal with the housing crisis in our state, simply because we do not today. If you could find me 800 units, we could move 800 people into apartments. The problem is there are not 800 apartment units available in Anchorage. To my knowledge, I just talked to our largest landlord in the state today. They have 15 available units. So again, we're talking about very incremental momentum forward until we find the housing to move people into.
Okay, that's very helpful. Thank you.
Thank you. I wanted to note for the record at 10:55, we were joined by Ms. LaFrance, and Nicole Lebo with the Health Department wanted to add some detail. Please go ahead, Ms. Lebo.
Thank you so much. Assemblymember Welton, I just wanted to add, I'm trying to pull the contract language exactly right now, but in terms of what it means to have a contact with our outreach workers, it's not just that they've gone and made an actual contact and said hello and tried to engage in services. It actually means that they have to enroll someone into the program and get them into the system, and that in fact they need to have then been connected to a resource. And so I can send you that exact language, but that's why that number is going to be less. It doesn't demonstrate the amount of work that's happening. It's just demonstrating the amount of work that's moving the process forward.
Okay, that helps too, because I went out once with Sean Sullivan and we contacted dozens of people. It was really educational. I thought, well, that doesn't jive. So, okay, well, that's real helpful knowing that. Thank you.
Exactly. That would not count for, the funder to say, yep, you have completed a contact, which means you've engaged with them more fully and actually connected them to a resource. So that's why the discrepancy will be there. And I will send out that clause of the contract to you.
Okay, good. Yeah, thank you.
Thank you, Ms. Lebo. If you can send that to myself, we'll have it distributed to the members via the clerk's office. I had a question, so I put myself in the queue for the coalition. Does the gap analysis, is that still a tool we want to rely on as we look at what types of housing we should or that are needed to meet this housing crisis? You mentioned, Ms. Boyle, if we had 800, sorry, if you're not speaking, could you please mute your phone? Thank you. Sorry, let me restate my question. Would the gap analysis provide us a bit more of some specifics around what kind of housing we may be looking at? You mentioned if we had 800 apartments, we could move 800 people into that. My guess is there's a variety of levels of housing that are needed, or is it simply we just need housing and investments in housing so that we can move people from shelter and then we can continue to address their needs?
Thank you for the question, Assemblymember Zalatel. We did do the gap analysis again. We intended to do it every year, and we completed it earlier this year. It is intended to be queued up for the new anchored home iteration that the coalition has been working on with partners, many of whom are on the phone. But if it is of interest, we could bring that analysis to next month's meeting and speak briefly more directly to your question. I don't have that data prepared today. But I'm happy to do that for next month.
Yeah, I think that would be really helpful to put, we acknowledge, with a 2% vacancy rate that they're, and if the largest apartment provider has only 15 apartments, we need to make investments to move people from mass care into the community. Then we need to kind of know where those investments could be made. So I would really appreciate that. And I'll just add that to the agenda for next month, in addition to the outflow, some specifics. Are there any other questions for the coalition about shelter outflow?
Assemblymember Zalatel, can I add one point to respond to Assemblymember Weddleton's earlier question?
Of course.
Thank you. Taylor ran the data really quickly to more specifically address Mr. Weddleton's question, and I want to make sure I share that. So in August, which is the month we're reporting for, our inflow for the total system in Anchorage for new homelessness was 402 individuals. And our aggregate outflow into housing was 100 individuals. So one, I want to be really clear that when I say 19 people moved into housing in August on this slide that I shared with you today, that was 19 people that were directly working with the 4 programs that are part of the housing surge. That was not everyone in Anchorage. There were a total of 100 individuals moved into housing in Anchorage in August, but 19 of them were housed through the housing surge, which is just starting. But again, my intent in sharing this data is to say, if we continue to see 400 newly homeless people show up every month, and even if we're managing to house 100 of them, we're seeing an excess of 300 month over month over month, and winter is coming. And again, I cannot emphasize enough, shelter is a critical part of the safety net. Shelter keeps people alive and well and on the road to stabilization. Shelter is a Band-Aid. And until we have the apartments, the housing, workforce housing, houses to move people into, we will forever need more shelter.
Thank you for that additional clarification. I appreciate that. Okay, any other questions at this point for the coalition? They will remain on the line with us should additional questions come up. With that, I will turn this over to Mr. Bob Dole with Mass Care to walk us through congregate and non-congregate care updates, and including some discussion about the utilization of quarantine and isolation. Mr. Dole.
Good morning. Hi, this is Development Services Director Bob Dole. Mass Care is temporarily assigned to this department. And I see our slides have come up, so if you could proceed to the second slide, please. Quick overview of what we're looking at today. We're running statistically in the high 300s at the Sullivan Arena at this point going forward. There are other facilities are pretty much running at capacity. We have a few rooms there, which is important when the medically fragile show up at the Sullivan. We can expeditiously get them into a more safe environment for them. So we always try to ideally have a repertoire of a few rooms there. The Sullivan is not, for many mobility challenges, it's not an adequate facility. Next slide, please. Quarantine isolation you're asking about, these are our total numbers that we're running, are the blue, the light blue on your chart there, and the black ones are the COVID positives that are running there as we're going through. Frankly, when we originally stood up a non-congregate shelter for quarantine and isolation, we envisioned if we went over 50, we would be standing up a congregate quarantine and isolation shelter again, like we did for the first wave of the pandemic. We have found that in working with some very capable, frankly, contractors, that we don't need to do that. We're able to continue the operation in this means. It's really important for that delta between the black that you see there and the blue in terms of those who are awaiting test results, or that we don't necessarily have to put them into an environment that increases the chances of getting COVID. As you can see there, the numbers are higher than we would prefer, but they are pretty much stabilizing inflow and outflow as we're going forward there, but we are able to accommodate these numbers going forward. And incidentally, these numbers are not, we get a few each week out of the Sullivan, but frankly, most of them come from other places where they cannot safely go through quarantine or isolation, as the case may be. Going forward, we're able to accommodate them here. And in our quarantine and isolation, it's a non-congregate shelter, i.e. hotel rooms. We do have enhanced medical screening and medical support there that also does limited case management while they're there in terms of attending to immediate needs going forward. It's working in terms of providing necessary services. We're able to accommodate the current levels. As we're going forward, we will have to reassess if we start seeing an increase over that max number. And really it's that max number of 100 that if we go much above that, we'll have to reassess how we're doing operations to still be separating these groups ideally from each other and also from other users of this facility. Next slide, please. And there's some question about I know there's been some discussion out there about the Site 1 is how we refer to the Aviator Hotel, and concern that what was going on with pending remodel and reconstruction was going to have an adverse impact on our ability to continue to provide this emergency support measure. In short, there is not an issue. They have given us a forecast drawdown schedule that is a gentle slope. We're frankly hoping to hit those first drawdown levels with just reducing overall demand on the mass care operation from rehousing efforts. And even as it goes out further, we will probably, if current trends continue, have to look at doing a request for quote and open up another non-congregate shelter site. However, this would be in the off season. And these numbers are still a decent density for providing services at this current location, and also we can do what we do and have done throughout this disaster, which is shift to other sites as necessary. There's several hotels that have participated in the past and don't now, and some of the ones now have popped up in, I think, probably the last 6-7 months. In short, hotel rooms are fungible, but there is concern out there. I will say that the management of this entity has been a great partner working with us in terms of making sure we can provide a safe, secure, sanitary environment, also facilitating what we need to do with getting folks moved on. But if there is still demand that we cannot accommodate, we just go ahead and shift to, we'll shift to another site. Next slide, please. Our movement to housing, we look at a little differently, and to be candid, I think we're missing some of the data points. Our mass care branch leader is going to be getting together with Taylor to try to provide a more coherent, consistent picture of how we're looking at things. Wanted to touch upon that first one. The Catholic Social Services Intensive Housing Case Management Contract. They've started to get some momentum there. That 13 is those that we know are in-houses now. It doesn't reflect the many more than that have signed leases and are waiting for move-in dates. And what's important for this is Jasmine touched upon barriers to getting people into housing. When somebody through this program is housed, the case manager will follow up to them typically for the next year to make sure they stay housed, to deal with issues, and also if need be to be a mediator with a landlord, so that this individual stays successfully housed. And more importantly, for this community as a group, it helps overcome some of the challenges to rehousing. We've euphemistically referred to those as barriers, but individuals with criminal convictions and past evictions are considered higher at risk and are more difficult to house. And by providing this ongoing case management for this group, we will substantially increase their chances of staying housed, and also we believe overcome some of the reluctance in the community as we go forward. That next block, that 0 is not, that's where we're not capturing the right data, where we have to have another discussion, some ongoing discussions in terms of how we're looking at versus ACEH going forward. The self-pay is an interesting group. These are the folks that Jasmine referred to are working, but still in shelter because they could not find affordable housing. And by working with these individuals directly who are making enough or helping them find solutions, we're able to get them to move out of the shelter system and pay their own way with minimal assistance. What's important about these going forward is it helps it's filling that area between those that will need ongoing substantial support, and these need maybe a little, and going forward. And then what we call respite care, those with medical needs or other programs they need to go into as we're going forward. We share Jasmine's and the coalition's observations about the difficulty of housing options. I'd note that the South Anchorage senior housing, I'm doing a walkthrough in it in a couple weeks. It will be coming online imminently. And also the CHA build out efforts continue at 36th and Spenard for some real quality housing. However, those together will not come close to filling the deficit that we're talking about units. Also, though, as we go forward with the means to show that to reduce the perceived risk of renting to our clients, we think we can also generate more of a demand signal for commercial landlords to be willing to assume more risk with this group. Next slide, please. As many of you are probably aware from the mayor's office press release on Sunday, the Sullivan is not shutting down tonight at midnight. It is having a change in shelter manager operator. This was a natural end of one contract and extensions, and in the process of competing it for a new operator, there's a new operator coming in at midnight tonight as we go forward. The municipality and the community will continue to provide mass shelter services as necessary to respond to COVID and subsequent to the disaster other ways too. So the Sullivan will be staying open for business, just a different operator. After any questions you have for me, we have Zac Sears on the line. Zac is will be the manager for 99+1, the new contractor providing shelter management services.
Great.
And,
thank you. Oh, go ahead.
I was just ready for any questions this group may have, and then I asked Zac to be prepared to say a few words about his vision.
Great. Thank you, Mr. Dole. So I'm going to put myself in the queue. As we look to the quarantine and isolation, one of the reasons I wanted to cover it today is we don't really talk about how it fits within the overall mass care operations. Could you talk just a little bit about who ends up in quarantine and isolation, how long those stays are, and what is the percentage of the rooms we have that we kind of generally have occupied? Thank you.
So just a second. Well, I won't need that for this discussion. For quarantine and isolation, it is anyone who does not have a safe place to either quarantine or isolate. This may be for somebody who's symptomatic a day or two awaiting test results, to someone who is COVID positive who may be there for 2 weeks going forward. They come from, frankly, across the board of being we get a few each week from our mass shelter. We get some from other providers. We get some who can't safely quarantine and isolate at home because of their family situations and the density there. We've had some families quarantine and isolate together because of their living conditions too. So it is an incredible mixed bag in terms of who comes there. It is not the big takeaway I would emphasize is it is not necessarily that they were elsewhere in the mass shelter system. It's folks that need to be somewhere where they're not going to risk infecting others and where there's ongoing medical screening so that if they take a turn to the worst, we can connect them with a necessary level of medical service. And if not, we can avoid some emergency room calls if it's just something that can be calmed or easily addressed at the paramedic level or below. In terms of the capacity there, at some point we start decrementing some other capabilities. My belief is we can go up to about 110 rooms before we have other impacts going forward. And that's 110 rooms, not 110 individuals. in that if we have couples or families, as we've seen a few of in the last couple of weeks, that's one room. It's not more than one.
Got it. Thank you. Quick follow-up question. Then we have Mr. Weddleton and Mr. Gates in the queue. What is the staffing at quarantine and isolation? What type of staff do we have there?
So at quarantine and isolation, it's a hotel like other hotels. We have security staff, and then our medical team that does the screening is on standby for other worsening conditions. Also does limited shelter management duties there as they're going around. They generally do 2 rounds a day. If somebody misses 1 round, they assume they were sleeping or something. If they miss the second round, they will have the hotel management open up the room for them. But generally, we have security staff and the shelter managers / medical screening side that also does, I believe, meal distribution there too.
Great, thank you. Mr. Weddleton, please go ahead.
Well, thanks. So, Bob, a couple points. One is kind of maybe you don't have a sense of this, but for just a number of rental units available, our population's gone down. It seems like just a few years ago we had increasing vacancy rate, and now it's plummeted to just a few percent. It's surprising me, that dynamic. Can you explain why we have such low vacancy?
I think there's different ways you look at vacancy. If you look at the vacancy many times looked at in this community, which is with affordable housing providers, in that group, because of, frankly, the declining economy over the past few years too, more people have sought out those services and are sought the affordable housing as they meet those requirements. The part that I think where the other part, though, you're right, the population has declined. Unfortunately, the population has overall declined disproportionately in the working population of about 25 to 60. And a professional taking their family, moving outside and leaving a single family house in an area off the bus system, for various reasons, is not affordable or likely to a good fit for our clients who are right above that affordable housing level and need a livable apartment with a minimum wage job. So although we're losing people, it doesn't mean we're freeing up units for this group, because disproportionately we're losing our professionals who are moving out. That being said, I think the other thing you're seeing in the apartment market at this point, there's some hesitation just putting some units on the market, or they're otherwise tied up because of uncertainty with eviction moratoriums and other things like that. I believe as we go forward into January, February, we'll have a better understanding of the true inventory of commercially owned and operated apartment units. But right now there's a lot of market factors and other factors that's kind of suppressing the willingness of landlords to rent.
Oh, that's interesting. Interesting point on the impact of that moratorium and people holding units off. Thanks. And Meg, I think it'd be nice to hear from Zac about plans for the Sullivan. Do they have a different vision than under Beans Cafe and so on? But that might be a whole separate meeting, so I'll leave that to you.
Okay, yeah, I know he's available here in just a minute. And we're gonna get to Mr. Gates' question first. Please go ahead, Mr. Gates.
Yeah, thank you, Madam Chair. Yeah, Bob, I'm sorry if I might have missed this already, but I had a quick question about the census numbers on your first slide. What was the date of those numbers and that count? And then I had a second question that's a little longer. On our other slide with the quarantine and isolation, and that's September, but I wondered in the longer time frame whether these numbers are tracking the trend we saw with the Delta variant. So, June and July, our COVID infections low, and we've seen that skyrocket August, September. So has quarantine and isolation numbers sort of tracked the same trend that we've seen with the recent rise? in that 3-4 month time frame?
Through the chair, Dean, my immediate response is objection, counsel, compound question. Going on to the questions you asked, however, there's a few parts there. First, on the census numbers, those were the numbers reported by the providers yesterday. For looking at population trends, we have two distinct trends. We have congregate and non-congregate put together, and then we have Q&I. If we look at congregate shelter, just that part, and non-congregate, those two, they basically go up and they have flatlined at whatever level of capacity we've built. It's only been in August with just as various programs coming forward with ARPA funds and the providers and the coalition, we've really started, I think, to affect and start pulling people out of that into long-range housing solutions. So overall, we've stayed whatever capacity we've had in overall in mass care stayed flat, and we may have I believe a little bit of a trickle starting now, at least in outflow. The inflow is a big question that other economic and other factors will determine. If we go to the next slide with Q&I, and Q&I up one. Thank you. So with Q&I by comparison, will mirror infection rates in the community, and it makes sense because the only, what gets you into Q&I is an exposure or generally or needing testing or having the thing. So I think if we track this all the way back to the first wave, you would see some correspondence there. It's actually fairly real time to. It's not like hospitalizations that lag. So what I think you're seeing now with that flattening out is consistent, at least with what we're seeing nationally, and hopefully we'll start to see in the state, where we're hopefully cresting on the Delta variant, and those numbers will start creeping down. I say that on a day when it appears Alaska set a new record for new cases yesterday. So it may be premature to say that, but the short answer for Q&I is it will generally mirror overall infection rates, Dean.
Thanks.
Great.
Thanks very much, Mr. Dole. I'll split my questions one at a time next time.
Thank you, Mr. Gates. Thank you, Mr. Dole. A lot of laughs from the lawyers in the crowd. With that, Mr. Dole, would you like to introduce the next speaker?
Yes, thank you, Chair. It's my opportunity to introduce Zac Sears to you. Zac has come on board with 99+1. He has worked in management positions in congregate, non-congregate, and affordable housing operations in Seattle and elsewhere outside. He also has spent a few years, 4 or 6, working in the behavioral health realm, which I think we all know can present many of the greatest challenges to our clients. He's been worked in there doing engagement and working to work with clients already, understands the operation. We have done a few walkthroughs. He's bombarding us with good ideas and just ways that he's looking at it, but I'd urge him to tell you a little bit himself about what he's thinking. Thank you.
Great. Thank you, Mr. Dole. Mr. Sears, you have the floor. Please go ahead.
I'd like to thank the committee for the moment of their time that I'm being allowed. Like Bob said, my name is Zac Sears. I'm the Congregate Shelter Director for 99+1. Bob asked me to speak a little bit about our vision here. And our team's vision is, I, being respectful of your time, came up with 3 main points. And the vision is one of safety, not only but for the guests, but for the entire community. And that looks very different depending on which perspective we're viewing it from. But our guests and our community matter, and we believe in service, the collaboration of resources for our guests from those service providers that I've worked for in the community and I've worked with. And there was mention of difficulty disseminating information, and I welcome you all to come to the shelter and disseminate that information. And I would like to be the point where somebody from South Central Foundation comes in and finds out about something going on for behavioral health or something like that. Also, it's success. You know, our vision is one of success, and that means different things for different people or entities. You know, sometimes a good day for somebody's a bad day for somebody else. For the businesses that surround us, it's lowering their risk prevention costs and things like that. But our successes for 99+1 is measured by helping those people that we serve have a better tomorrow than they did today. I really, honestly, that's about all I have to say at this moment. If there's any questions, I'd be happy to answer them.
Thank you, Mr. Sears. I'm happy to hear about the client-centered approach. Any questions? I believe we also, or I have your contact information. I'm sure you'll be seeing members possibly down for tours or just wanting to learn more. So thank you so much for joining us. I know it's a very busy time for you all as you make this transition. So thanks for joining us today. All right, we're going to move on to the last item of our agenda, which is the Community Resource Coordinators update. This is the program that is at the library, and I believe we have Rebecca with us today to tell us what she's been up to and what that program's been doing.
Yes, and good morning. Can everyone hear me?
Yes, and we've got your slideshow up. Thank you. Please go. Please go ahead, Ms. Barker.
Thank you, Chair. So my name is Rebecca Barker. My title is the Community Resource Coordinator at the Anchorage Public Library. And thank you very much for allowing me this time today with a packed agenda. I appreciate it, so that I can share a little bit about our program. The last time I presented to this committee, it was early 2019, which now feels like a world away. So today I'm going to try to introduce or reintroduce what this program is, what we've accomplished so far this year, and why I think it's a valuable tool in Anchorage's toolbox for addressing the complex issues of safety, behavioral health, and homelessness in our community. Let's see. Okay, there we go. So the first question is, why is there a social worker in my library? In 2017, data was collected in a survey from just about 800 library visitors in person, and the results were really striking. This survey was not actually designed to poll our patrons who were experiencing homelessness in any detail, but it did include a question about housing resources and housing situation. And roughly 1 in 4 of respondents self-identified as currently experiencing homelessness. And just a little bit higher, mostly the same number of folks also self-identified as mental health trust beneficiaries, meaning that they experienced one or more of the categories listed here. So I will not read this whole thing for you, but basically to just highlight a couple of points, this all started in 2015 because a librarian met with a social work professor at a local conference. And excuse me, I was very fortunate to get to be that first student in 2016 as an MSW student at UAA, and kind of start the ball rolling on what social work in an Alaskan library can look like. We are the first and only program of our kind in the state of Alaska. I'm so sorry, I've got some folks at my door right now. So just to highlight, students have been an ongoing part of this program, and they're not paid. So it's work that's done for this program without expense to the city or to grant funders. The other thing I'd like to highlight from this timeline is that our doors were closed to the public. Services were still ongoing, but our doors were closed most of 2020 and for the full first quarter of 2021. So that did impact some of our numbers. I believe that the 2020 report was disseminated earlier, and I'll have some of those confirmed successes for 2021 so far in a couple of slides. And then, of course, I like to highlight the huge milestone of getting to bring on Ziona Brownlow as Assistant Community Resource Coordinator in November 2020, and most recently bringing on Latoya Alloway about 10 weeks ago. So for about 10 weeks, we've been able to operate as a 3-person team. All right, so what we do is we operate mostly focusing on outreach and programming, providing the most current and accurate information we can to our customers, and relying heavily on the network of providers outside the library. So our role is really to help folks navigate a system that can be overwhelming or complex and confusing. And that can mean housing, it can mean wellness resources, it can mean food resources, it can mean job activities. So all of those things, but we do intersect with a lot of the housing providers. So we're really grateful for those partnerships because this operates entirely on partnerships. I don't have any particular money for, putting people into housing myself. I have to rely on the connections that we have in the community. So programming to highlight is Housing Lab. We had 263 attendees. It's an open house workshop that we run through 2019, and we brought it back in 2021. We've had 19 participants so far, so we're just hoping it can keep going. And we respond to community needs. An example would be that when the AHFC first wave and second wave of rental relief was released. I don't know if you saw that in the slide above, but half of our patrons don't have internet access at home. A great deal do not have the digital literacy that's required to access those essential resources. So little plug, Friday, 2 to 5 this week at the Mountain View Library, we will be assisting people in person to get those documents uploaded and just helping navigate. It's a good example of the kind of services that we can do. And something else to highlight is that there's 50 other programs across the United States that have a social worker in a library, but this one is ours. It's a little bit differentiated from some of those other programs because we stay a little bit more within the traditional lane of a library. We're not doing long-term case management. We're not emergency service providers, and we don't do clinical work, meaning I don't provide therapy or treatment to folks. And we operate more within the traditional lane of a library by providing information and connection to services in the community. We're not duplicating services. We're trying to bring the providers and their resources to where the needs are. If we remember that 1 in 4 number of the libraries, that's where we have a population of folks. This is a quick shout out to the folks who have forgive my informal language. A sincere thank you to the first 3 years of financial support. This has been grant funded for 3 years since it started September 4th of 2018. And then there's a brief and very incomplete list of our community contacts and folks who have been, we make connections to and with for our library visitors so that they can enjoy the library for its original intended purpose. Okay. Yeah. Our hope for 2022 is that the team construction will look something like this. We'll have a community resource coordinator. That is the role I'm in. Assistant CRCs, which would be Ziana and Latoya, and the addition of peer outreach workers. Those are folks who have lived expertise and experience. They would be able to make connections within the library, mostly based at LUSAC because that is the building with the most square feet. And those are folks with that lived experience, so they can bring that expertise and that connection. So when folks are ready to go through the arduous task of connecting to resources, they can do that warm handoff to the CRCs who can take them to the next steps and hopefully get them connected to a longer term support outside the library. In these numbers, what you see is folks that we have confirmed successes with. One challenge of this program has always been clocking our verified outcomes. To put it in sort of library parlance, just like when someone comes to the library and checks out a book, we don't check to see if they finished it. And similarly, we don't necessarily know if people have continued with the behavioral health supports, for example, that we've connected people with. However, these numbers are confirmed successes for a connection made in 2021. Those housing numbers, a lot of that is with a huge thanks to the coordinated entry team, the coalition, of course, is the coordinators there. But we've also able to connect people with programs that are outside of that mainstream access to housing. So we have an option to get creative with folks. Additional data is just sort of points of interest. We have a pretty equal gender split, but over half of our customers are over 50. We do have sometimes some very poignant stories. I got to meet a woman yesterday who is 76 and she's couch surfing and she has income. And so we'll be working with her to trying to find a place where she can live independently. She doesn't have additional vulnerabilities or needs. She just can't afford what's available and doesn't have the online skills to, really hunt for those rare gems of apartments. But we're going to work with her. We've also been working with our security team and our staff to either resolve or divert APD contacts for high vulnerability patrons that involved us helping revamp the code of conduct and procedures around that so that we are more appropriately using APD if and when needed, but otherwise resolving things in-house. Our overall resolution rate, and this is a little bit shaky, but of the folks who come to us seeking assistance with housing, we've been able to resolve about 1 in 5, meaning they either were able to move into housing with our support and others, because of course we rely on our partners, or we were able to, with the support of our partners and those resources, keep them in their housing or get them back into their housing. We also do keep some data on whether people, this is just self-report, whether they choose to access shelter or whether they're unable to access shelter, if that's how they feel about it. So we do have a fairly high rate of folks who decline shelter, and we do collect the information on what their justification for that is. What do they seems just a point of interest. We do use HMIS in an unshared project to collect our data and would love to share that with anybody's interested. And this is my contact information. I'd love to hear from anyone who's interested in partnering or learning more, visiting library. And, I think my closing, comment might be, if I may, that just here's a picture of our lovely patrons. When you see it in your community, you're going to see it in your library. And we know that whether our CRC team is present or not, that there's a really high need. So just thank you so much for a little bit of time to let me share about what we're working on to try to meet that need here.
Great. Thank you so much, Rebecca. No worries about being informal. Shout outs are always appreciated, especially to funders and partners. I've got Ms. Kennedy in the queue, and then I'm going to put myself in the queue. Please go ahead, Ms. Kennedy.
Thank you, Madam Chair. I do have a question. Thank you so much for the information. I recognize that this has been a bit of a challenging kind of approach to trying to deal with the homeless that frequent the library. But I appreciate too the information about the numbers on the successes, if you will, of getting people into housing. And so I kind of want to delve into that a little bit, because I kind of might be getting a disconnect here. But you mentioned that you don't really actually put people into housing. So who do you call when you're trying to find housing for someone? And then with that, I guess I'm kind of wondering how those numbers of those who are successfully counted or who are successfully housed are actually counted, and whether or not they end up actually getting double counted. Because if you all are counting them as having gotten into housing, but you refer them to another entity that actually does the housing, if they're also counting those same people as being successfully housed. So couple of questions there, if you don't mind. Thank you.
No, thank you so much. I think those are excellent questions. And the first would be, who do we refer them to? So we refer folks to AHHC, to CHA, NeighborWorks, Rural Cap, coordinated entry, and then sometimes directly to Catholic Social Services. We've had some direct resolutions, not necessarily waiting for a permanent supportive house, not necessarily waiting for a prioritized coordinated entry resource, but rather working with all of the other resources in town to try to figure out what the unique match is for that person. We also access Shiloh and the ADRC for rapid rehousing dollars. So those are some of the resources that we tap into. And absolutely, you're right. The library itself is not paying for housing. These numbers are to indicate what our program considers a success, which is somebody had a need and we found them a resource for that need. So these numbers are not getting reported out in terms of like community totals. So it's a great concern about double counting, but this is the information that's coming from me to you today. That's as far as that information goes. It's not adding into, the ACH totals, if that makes sense. And Jasmine or Taylor, if you're still on, I definitely love collaborating with you guys, but if you feel like confirming that like my HMIS project does not actually share out to your totals, does that, I can.
Sure. Thanks, Rebecca. Taylor, do you want to jump in here too?
Yeah, I can kind of elaborate on that. Hi again, everyone. This is Taylor from the Anchorage Coalition to End Homelessness. Without going too into how the system functions, if the library were to enter someone who's experiencing homelessness and then they were able to what we would call self-resolve, so maybe find housing with a family member or a different program that's not part of HMIS, that would be reflective in the overall system of clients who were moved into housing under self-resolve. Similarly, if the library were able to connect a client to coordinated entry, and that client was then housed through a housing program at, say, Rural CAP, they're only counted as being housed through that Rural CAP program, and that's reflected in our data dashboard, which I can link in the chat as well. It's ach.org/data as a housing placement and moving to a permanent housing destination. But they aren't reflected as a library housing placement and an ACH housing placement and a Rural CAP housing placement. It's just the one. All of our numbers are based on a client's experience and not on a provider's experience to limit any sort of double representation of clients.
Thank you. Appreciate that answer and just all the detail. Madam Chair, can I ask one more?
Yes, please go ahead.
Thank you. You also mentioned that there were some people that were using shelter and some that were not. Do you have a sense of how many of those that are not using shelter are actually camping somewhere near, that they're doing the outdoor thing just somewhere around the library, Cuddy Park, Walmart? Do you have any numbers that you can break that down?
That is a really good question. Right now, our data collection is just a yes, no for shelter access or not. We're not recording like camp locations, but that is a really good thing to kind of add into the details. There are campers. There are folks who I don't really know how to describe it, but they don't actually know where they're going to be staying that night. Sometimes they're doing survival activities to try to couch surf with friends or family, or they walk all night. There's a variety of adaptive measures people take. And there are some campers who are in and around the Midtown area, and also the Mountain View area, and also the Muldoon area. That's the 3 city corridors where we operate, where we see the needs. And then we've also got a lot of car sleeper folks. And sometimes those are folks who have a vehicle and don't feel like they can access shelter and they don't want to leave their vehicle to access shelter, or they have pets in their vehicle. They don't want to leave and they can't access shelter that way. Or, they may actually be working. That's fairly common. I will work on developing us keeping better track of that, those particulars, but that's not information that I have on hand. I can just give you a kind of anecdotal sketch there for the time being. I'm happy to follow up later.
Okay, thank you, Ms. Barker. Actually, that answered, really what the question and kind of what I wanted to get at. So I appreciate that. So thank you. Thank you, Madam Chair.
Thank you, Ms. Kennedy. I'm going to invite Claire Ross, who is the Assistant Director of Strategy and Development for the Public Library and Anchorage Library Foundation, to share her screen. We have an additional handout. It just went out to members, and I'm going to get it posted right on the website. So Ms. Ross, when you are ready, please take it away.
All right, can you see my screen?
Yes, ma'am.
Wonderful. Thank you so much for having us today and supporting Rebecca's presentation. The reason why we're presenting today is that this program is not funded for 2022 and going forward. We pitched last year to be part of the alcohol tax funding, and the Assembly and administration were very supportive of that at the time. But then the Finance Department found some additional grant money to pay for our program one more year through grant money. And so that runs out at the end of this year. We think this is a highly successful program. It's very inexpensive. It makes our libraries safer, more welcoming, and efficient. And so we really don't want to see this program go away. So I've included an overview of what it would cost to keep the program running next year and into the future. And we would just ask for the Assembly's support of including this in the alcohol tax funds.
Great. Thank you, Ms. Ross. I very much appreciate that. And as I said, the detail is getting posted up on the committee's website and has gone out to all members. Are there any questions about this or any other questions about the community outreach? Mr. Weddleton, please.
Well, thanks. So, for Claire, Rebecca, so, as we're discussing, ways to move forward with sheltering homeless, of course, the notion of a navigation center is pretty much best practices. So if there were, you provide clearly needed services at the library, but if there were a navigation center that had internet access, warm place, some food, comfortable place to hang out, and if there were one in Midtown, say, would your clients go there instead? Is that something preferable to what you're doing, or would you?
Rebecca, I'll jump
would
in.
you still need it? I know that's a tough question, so just postulate. Thanks.
I can jump in and then also let Rebecca go. I think the point of our program is that we serve library patrons. We're not going out into the community and trying to bring in new people who aren't using the library to then give them social services. So we would always need this service at the library. I think any Midtown services would probably help bring some relief, because for a lot of the people who go see Rebecca, there aren't other places to go. But we do have the need really highly in Mountain View and Muldoon. And it's not just people who are staying in shelters or camps. Like Rebecca said, a lot of people are somewhat housed, somewhat employed, and living on the edge, and they're not going to go to a mass congregate shelter, or they might not even go see Catholic social services, but they happen to be in the library for other things, and then we can connect them where they're at. Rebecca, do you have anything to add to that?
Absolutely. And thank you, Claire. Thank you. Thank you, Assemblymember Weddleton, as well. I love this question, and I've gotten it before. I would love to have a Midtown or other located community resource center that focused on the needs of folks who are trying to navigate these complex issues around housing and homelessness, because that would free me up to work and focus more on seniors and families who are here. Right now, we prioritize single adults as a general rule, or folks who are in that kind of tipping into crisis. Not exactly, I should use my words more carefully, but if those needs were taken off the library's plate, I think that would be fantastic. Right now, we're filling a gap, and we all pull together and do what we can as a community, but I think that would be something that would be great. The hope would be that folks could get their community resource needs met at the Navigation Center, and then they can come back to the library to check out DVDs and books like they do every day, and use the library for its traditional purpose, which is what we honestly do see a lot of folks doing. It's just being here. I was talking to several people yesterday, and they're here because it's peaceful. They're here because it's quiet. And this is an added necessity if they have those community resource needs. But if they were able to make those, if there was an accessible and navigatable navigation center, I think they would really love, and I'd love to direct people to that. I'd also add, again, I have more anecdotal than solid data on this, but a lot of our folks who are not accessing shelter is, I think, because their needs are getting met in Sullivan and in those shelters where they have navigation, where they have those resource connections. Our folks who are not accessing those shelters are in the libraries. So it's, I hesitate to say it's a perfectly distinct population, but without more solid data. But I hope that didn't get too convoluted, but the shorter answer being yes, it would be very helpful. And I do think it would be well received. And there's plenty of work for us to do with folks who are housed, folks who are seniors, folks who are just low income, who are complete strangers to the safety net programs. There's plenty for us to do.
All right, thanks. That's very helpful. And just for the world, I appreciate Rebecca. I met her at the Housing Resource Advisory Council meeting. I think it was last week, and it's very clear that you've built a good rapport with that community. That was nice, and appreciate you and Ms. Eldridge hosting their meetings there at the library while you're doing that. Thanks.
Thank you, Mr. Weddleton. Thank you, Ms. Barker. Yes, a very important piece to the continuum of care as we talk about homeless response services from prevention to housing. So with that, I see no other questions in the queue. So we're going to turn now to legislative and budget priorities. And I thought I would take this opportunity to talk briefly about what we've submitted to Assembly leadership for budget priorities for around homelessness along the continuum of care or related services. So one is this program that you all just heard about at the library. In addition, making sure that the Anchorage Safety Patrol continues to be funded and exploration of what it would cost to expand that program because it helps reduce first responder costs. And a lot of times there's overlap in the individuals needing those services and those experiencing homelessness. Full funding of the mobile crisis team within the alcohol tax budget. Operational dollars to bring online necessary drug and alcohol treatment centers such as the Golden Lion. Finding full funding for homelessness outreach services for 2022, including the possibility for transportation. And then the last is a slightly different item that we really haven't talked about, but it's one of two options really, and it's the idea that we develop either a dedicated department or Office of Housing Solutions that really combines the response to homelessness services from a health department and that HUD funding, as well as the chief housing officer and the homelessness coordinator position, so that we can really have a coordinated response. I think we've heard some of the frustrations right now around communications and a coordinated response. Or we delegate and we fund to delegate those coordination and those communications to an entity like the coalition. So I think it's something that proposals need to be further developed, but we are really missing that coordination piece, I believe, right now in the municipality, and it is causing a lot of duplication of efforts and maybe not allowing us to leverage our funding as well as we can between operating budgets, alcohol tax budgets, HUD funding, and then the COC funding and philanthropy. So just putting all of those on your radar. If there are any others that members would like to bring forward at this time, I would be happy to hear them, and I can certainly pass those on to Assembly leadership as we do move into budget season. All right, hearing nothing, there's the invitation to reach out. Should you have any additional ideas or funding priorities you would like moved forward. Of course, also built within there is the conversation about operational capacity for homeless and transient shelter within the 2022 operating and alcohol tax budgets, somewhat to be agreed upon through the facilitation process. So more to come there as well. All right, with that, are there any members of the public who would like to participate? I did have Mr. Haberman sign up. Are you available, Mr. Haberman?
Yeah, I'm here.
Okay, please go ahead.
My name is Eugene Carl Haberman. I represent myself. I follow the public process. When the public process is done appropriately, the decision made by the governing body is more likely the public interest. First thing to note is I do need to also still compliment the fact that as Assembly members and administration, in these meetings you address homelessness issue and continues to be a failure yet to remind us when the Metro Borough, over 100,000 people even use the word homeless issue in their meetings, and you continue to be involved, and I appreciate that very much. Second thing has come to my mind is that when you hear about numbers and people's needs, what are the numbers that are people coming from around the state, particularly in the Valley, coming to Anchorage and dealing with an issue of being homeless, and they're not being taken help in their communities? I'm not hearing those numbers coming out over the course of time, and I would appreciate that some attention is to take a look at is where these people are from and where they're traveling and coming into Anchorage. I'm not questioning their right to come into Anchorage, but the fact is there has been a failure in other communities, particularly in the Matsu Borough, where they fail to even use the words homeless in their borough assembly meetings and school board meetings. And the fact is that you're dealing with a difficult issue, and more look should be addressed to how much more of your involvement is because people are coming to your community and asking for assistance. Second thing is, as you expect, I'll be talking about these teleconference meetings. I was listening to the presentation reports, and some of those reports did not take into account the pages that were on the site, on the website, where the public can take a look at those documents. They're different from what the presentations were, and that concerns me. And also the last piece is this. I know of only one party, principal party, that has a handle on doing teleconferencing. And that's not Assembly Committee meetings, but it's the Port of Alaska Commission meetings. They're moving back to, because of COVID, they've decided to move back to teleconferencing, but at least they have a good handle on being connected. So the public on this meeting is being able to speak and listen by audio, whereas Assembly members on this meeting can have the opportunity to link in to see visuals. And that is not a fair and real way, an appropriate way to connect the public and yourself. And my time is up, and thank you very much.
Thank you, Mr. Haberman. You raised a good point, and we'll see if we can't, in our next updates, get some information about the impacts of statewide homelessness on Anchorage. I know Ms. Boyle has covered it previously. I realized I was remiss. I was asked to have us briefly touch on the plan for family winter shelter for this coming season, and I believe Mr. Dole can give us a brief update. I apologize for having to go back, but Mr. Dole, could you just give us a really brief update?
Yes, Chair. Briefly stated, because COVID and the concern has eliminated many of the existing providers being able to provide this service, the funding approved last night is the first tranche to providing that service. We were talking to 2 or 3 interested providers. We have the funding, and we're going forth with the process to get providers online. Right now, we're shooting for a target load of 20 to 30 family housing situations, i.e. rooms, most likely.
Great, thank you, Mr. Dole. And I will just add that to the ongoing mass care updates as we move forward, just so that we track utilization and ensure that we have capacity for families this winter. Turning back to audience participation, was there anyone else who wished to participate? And Ms. Turner, please go ahead. Who is it?
Yes, I'd like to participate. This is Michael Burke.
Okay, Mr. Burke, please go ahead. You have 3 minutes.
I just wanted to take this opportunity to again thank each and every Assembly member for the incredible hard work that you're all doing on this. This is a very difficult, a pressing, and a complex issue. I know it takes a lot of heart and soul, and I just want to thank all of you for the hard work you're all doing. This is not easy, and you have the appreciation of so many of us out here in the community. Perhaps you don't hear from us often enough, but thank you. That's all I have, folks.
Thank you, Mr. Burke. Anyone else like to participate? Okay, I am hearing from no one else. So with that, I would like to thank everyone for joining us today at the extended time period. We may be considering extending these meetings as a regular practice, just so that we don't run up or have to go over, as these agendas are often rather full. And thanks to our presenters today. And with that, we are adjourned. Everyone have a nice afternoon.